Radio Philippines Network. Radio Philippines Network. DXDX 693 kHz. Ang inyong Radyo Ronda sa syudad sa mga kampiyon. Live to the world pinaagi sa FB page karon mag-download na pinaagi sa Google Play ug Apple Store, YouTube ug Twitter. Alang sa mas kipakuskan nga mga balita, komentaryo, kasayuran ug kalingawan. DXDX Size 93 ang mas kipakuskan nga inyong Radyo Ronda.
This station is now the ultimate power in the universe.
Gastritis is a growing problem in Asian countries, including here in the Philippines. The condition causes inflammation of the stomach lining, triggered by stress, excessive alcohol use, certain medications, just to name a few. Now, people with gastritis experience nausea, abdominal pain, indigestion, and even at times vomiting. Now, the condition alone isn't serious for the most part, and it can go away within a few days. But as with many diseases, if left untreated, it can lead to other, even serious medical conditions. On the program today, we'll talk more about the causes of gastritis, how we can prevent it, the symptoms that need to be addressed, and how to manage and treat the disease. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. We all have a protective lining in our stomachs called mucosa. It's there to protect our stomachs from the strong stomach acids that digest the food that we eat. When something damages the mucosa, it then becomes inflamed. That's when gastritis happens. With us is Dr. Jonathan Babsay. He's a family medicine specialist from the UPPGH. And also with us is Dr. Marie Michelle Simbol-Cloa, who's the chief of gastroenterology section at the Manila Doctors Hospital. Now that we know what gastritis is, let's discuss naman. Let's talk about kung anong nagko-cause nito. Anong mga factors that may cause gastritis?
So the two most common causes of gastritis is still H. pylori or Helicobacter pylori, or what we call also the pain relievers or the non-steroidal anti-inflammatory drugs.
A lot of our viewers still believe that the diet plays an important role of this. Masyado maraming ininom na kape, masyado maraming spicy food. Dr. Joe, what do you think? Is diet still a main factor when it comes to gastritis?
Food in general does not really cause gastritis, although may mga factors na pwedeng mag-push to that, mga kunwari, alcoholic drinks, mga ganyan. However, if you already have gastritis, yung mga pwede natin kinakain can trigger the symptoms of gastritis.
Doc Joe, why is gastritis common in countries like ours?
Isang factor na pwede natin matanggap ay may possibility na medyo laganap ang H. pylori sa atin. Kasi mas sinasabi nila na kapag maraming compact, yung nakatira sa isang area, low-income families, ganyan, medyo mataas talaga yung incidence ng H. pylori. Kaya more than likely laganap siya sa Pilipinas. And maraming factors na nakaka-apekto sa Pilipinas na magpaparami ng gastritis.
Are there activities that Filipinos do that may make the risk of them developing gastritis higher?
Skipping of meals, so masyadong bugbog sa trabaho or walang makain talaga na pagkain. Yung pagpili, tas minsan mabilisan yung pagkain natin, so nakaka-cause yun ng symptoms. Or minsan yung choices nga. Hindi man siya nakaka-cause talaga ng gastritis, but then it can trigger yung symptoms talaga ng gastritis.
Are there symptoms that could be so mild during the earlier stages of gastritis that a person will not mind this at all? Kumbaga, it's not something that they would notice. This is something that is not significant, but could, if unchecked, could later on lead to even more serious conditions.
Since gastritis really is a histologic diagnosis, so at first, patients with gastritis will really feel something. So for patients with dyspepsia, they would notice that they would have abdominal discomfort or pain, as I mentioned, in the epigastric area that's in between your ribs and your belly button, no? But with gastritis, you would notice that patients will complain more symptoms or more severe pain or more frequent symptoms or more with alarm features like anemia, there is passage of blood in the stool, or sometimes there is nausea, vomiting, and they have early satiety. They can no longer eat very well.
How is gastritis related with stress?
There is an increase of your acid output in your stomach. So with increased acid output and with the lessened defense mechanisms of your stomach, this can also produce your gastritis, if not outright ulcer. All right, so stress per se can trigger symptoms of dyspepsia. At worst, can cause gastritis or ulcers as well.
Now, I think it's important that our viewers know some of the differentiation, Doc Mitch, between gastritis and gastroenteritis. They both sound the same, but what are the differences?
For gastroenteritis, we're referring to infections, either viral, bacterial, or parasitic, that involves the small intestine as well as the function of your stomach. So they're different because with gastritis, we are referring to an acid-related disorder.
Let's recap. Ano ba yung mga pinaka-common symptoms na mararamdaman ng isang tao who has gastritis?
Pananakit talaga nung sikmura. So, kung nasaan yung tiyan talaga. So, yun yung pinaka number one. Yung iba pang pwedeng maramdaman would be pwedeng may pagtutuwal, nasusuka, yun yung mga pinaka-common doon.
Pwede bang mapagkamalan ang simptomas ng gastritis with that of indigestion o ang impacho?
Ang impacho basically or indigestion ay hindi siya diagnosis, pero sintomas siya na yun niya, parang puno yung tiyan, may abdominal fullness, bloated ka. So, ang kaibahan niya sa gastritis ay ang indigestion, pwede siyang sintomas ng gastritis. Yan. Pero pwede din ang indigestion ay nagkataon na wala kang gastritis pero kumain ka ng marami, kumain ka ng mabilis, fatty food yung kinain mo, punong-puno yung tiyan mo, pwede kang magka-indigestion.
Our stomachs have a protective lining against strong, very strong stomach acids that help in the digestion of food. Now, our body is designed to handle normal levels of acid, but can fluctuate from time to time. And there are certain factors that will make the body actually produce more acids. Doc Mitch, when does this happen? And can the amount of acid that you produce be controlled, avoided, or even prevented?
It can be increased with stress, also with intake of your medicines, like your non-steroidal anti-inflammatory drug. And naturally, we produce acid because it's needed for digestion, especially of proteins. And then acid output also increases early in the morning. That's why patients have nocturnal symptoms. So one way to lessen the acid is to take medications that can control the acid output.
Now, gastritis is a common, treatable condition. If not, it may lead to stomach ulcers, stomach bleeding, and other medical conditions. And we'll discuss these complications when we return. So stay with us here on MedTalk Health Talk. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, your partner in healthcare. Now, in very rare cases, gastritis can actually lead to complications like a stomach ulcer or even stomach cancer at the worst. Now, this is why if you're feeling any of the warning signs that were mentioned earlier, don't ignore them. Gastritis may improve quickly with proper treatment. Dr. Joe, what are some of the complications ng gastritis pag pinabayaan lang ito?
Number one, yun nga, ulcer. Tapos kapag napabayaan yung ulcer, pwede siyang pumuntok, pwedeng magdugo, which can lead to complications. Tapos since gastritis kasi pamamaga siya, so nagkakaroon talaga ng changes to sa lining ng ng stomach natin, lalo na kung may H. pylori pa. As you said, it can also push our patients to develop stomach cancer.
Dr. Mitch, can we explain to our viewers how chronic gastritis can increase naman the risk of stomach cancer? Because it's one of the most diagnosed cancers worldwide.
When we check for bacteria that can cause gastritis, which is commonly associated with it, ang tawag po is Helicobacter pylori bacteria, that is associated with ulcer formation as well as cancer formation in the stomach. So if we treat the bacteria, we also lessen your risk for gastric cancer. So that is important.
Is there a certain time where they should seek help from a doctor right away?
If you are more than 55 years old and it's your first time to experience symptoms ng paninikmura, then it's about time that you really have to see your gastroenterologist and perform an endoscopy. For patients who have it long time, kasi nga because it is usually associated with chronicity, ibig sabihin years na pabalik-balik at natotolerate naman, kakain lang, nawawala na yung sakit or antacid lang, wala na. You go to your doctor especially if these symptoms are more frequent, more severe, and you are now presenting with more alarm symptoms. Pamumutla, nasusuka, hindi ka na makakain, pangangayaya.
What is the definitive test to have a diagnosis of gastritis, Dr. Mitch?
Gastritis is basically a histologic diagnosis. Ibig sabihin po, kumukurot kami ng sample dun sa lining ng stomach, and then sa microscope may makikita kang mga inflammatory cells. So that is really gastritis. But we suspect gastritis if we see some abnormalities during endoscopy. Ito po yung pagsilip sa lining ng stomach using an instrument para siyang stethoscope na merong camera at ilaw sa dulo. Outpatient procedure lang yun. So, in that procedure, we will see the lining of the stomach. Also, if there are abnormalities, especially now with image-enhanced procedures, makikita po namin na yung hindi na siya normal. So, we can do biopsies.
Now, Dr. Joe, what are some of the common complaints that someone would think of seeing a doctor? At what point do they feel na kailangan nilang pumunta sa doktor?
Anytime na may abdominal pain ka, lumalala, or may gamot ka nang iniinom pero parang hindi nag-improve. Usually yung time frame medyo matagal ang gamutan. Yan ang tandaan ng audience natin na pag gastritis, mga 4 to 8 weeks yan na gamutang dire-diretso. Tapos kung hindi nag-improve, then definitely kailangan magpatingin. Worst dyan would be anytime na meron ng alarm, namumutla ka, sobrang namamayat kahit lakas mo kumain, namumutla, suka ng suka, hindi makakain, sobrang sakit ng tiyan, may maitim sa dumi, kahit isa lang doon, check up ka agad. Kasi pwedeng senyalis na yun na baka may pumutok na ulcer or may cancer na pala, ganyan. So, huwag talagang baliwalain. Basta lumalala, hindi nag-improve, check up ka agad.
And Doc Joe, when it comes to the treatment for this, okay lang ba na mag-self-medicate ang isang tao? Since it's caused by H. pylori, pwede lang ba silang uminom ng antibiotic of their choice with this?
Alam naman natin yung batas, huwag mag-self-medicate na antibiotic. Tapos may specific talaga kasi na gamot para sa H. pylori na kailangan mo talaga ng prescription. And sa batas talaga natin, hindi ka pwedeng bumili ng antibiotic na walang reseta. So, and kailangan masigurado kasi natin na meron kang H. pylori. Kasi once again, siya yung major cause, pero hindi lang siya yung cause. So baka mamaya nag-antibiotic ka, wala ka palang H. pylori. Walang effect yung antibiotic. Una, sign sa pera, side effects. Yun, baka pwedeng mag-additional complications pa. So, huwag mag-self-medicate. Mas maganda magpatingin pa rin muna sa inyong doktor, lalo na kung involved na yung antibiotics natin.
Doc Mitch, how long is the usual course of treatment for someone with gastritis?
We have to determine if, first of all, if this gastritis is caused by the Helicobacter pylori bacteria. So, we have to treat the H. pylori for about 10 to 14 days. Then for gastritis per se, it depends on what we see. If there is no ulcer, it's just plain gastritis, we just give the medications for about 6 weeks.
Are the symptoms of an ulcer distinct from that of gastritis?
Hindi siya maaring ma-distinguish because ulcer is not diagnosed through kwentuhan lang. So we really do have to do confirmatory tests and do endoscopy.
Eating a good and healthy diet can contribute to lowering symptoms of gastritis because there are many benefits to eating a good, well-balanced diet. When we return, we'll talk about what types of food are recommended. We want to be your partner for a lifetime of good health. Keep it here on CNN Philippines. On Dr. Freddy Gomez, and this is Med Talk, Health Talk, where your health always comes first. We always talk about the importance of a healthy diet because it really goes a long way. Now, there are several foods and beverages that can trigger heartburn and increase acid production in general. Doc Joe, let's give our viewers some examples of foods that may trigger or increase those symptoms ng gastritis.
General ang advice talaga naman natin, lalo na kung meron talaga silang pre-existing gastritis, would be iwasan ang maasim, maanghang, coffee, soft drinks. Minsan, onions, garlic, yun yung mga parang basic. But once again, minsan binibigay din natin sa patient. Kung natotolerate naman nila, okay lang. Pero kung napansin nila na it's causing symptoms, dapat iwasan na. Parang ganun. Sometimes eating fatty food also also triggers your symptoms.
Continue natin doon sa advice mo. Bigyan mo ng advice sa ating mga viewers kung anong magandang mga pagkain that can decrease acid production or keep them at normal at best.
Ngayon yung sasabihin natin na meron talagang pagkain na pwedeng magpababa ng acid, medyo pinag-aaralan pa yun. Wala pa talagang definite na masasabi na ganun talaga. Although may mga nakikita na tayo na parang ginger, mga lemon juice, ganyan. Kaya lang, once again, walang pag-aaral pa to say na they're really effective.
Now, Doc Joe, ang timing ba ng pagkain ng isang tao can contribute to gastritis? Yung mga mahilig mag-midnight snack dyan o yung mga bago matulog, kumakain, could this contribute to gastritis?
Kasi remember, ang trigger ng ating pag-produce ng acid natin is actually food intake. So, pag kakain tayo, that stimulates the brain to sabihin sa tiyan na, kakain, kailangan ng panunaw. So, it now produces more acid. Lalo na kung, di ba, mahilig natin in midnight snack, minsan mga oily, fatty, protein, yan. So, when that happens, yun, nasa-stimulate lalo na mag-produce ng acid and makes you at risk na mag-develop ng gastritis.
Now, Doc Mitch, saan nakukuha ang H. pylori? Paano ito pumapasok sa katawan ng isang tao?
Is human-to-human transmission. So, fecal-oral route, so naisusubo siya at naidudumi. Yung dumi na yon, carry niya yung H. pylori, then that can be ingested by another person. But actually, sa totoo lang, Doc Freddy, hindi nila talaga matukoy how one gets it. In other ways, maaring siguro sa infected scopes, or bakit yung iba hindi naman na ang kakaroon at bakit yung iba meron.
It's best to know the management for it. So have yourself checked to get the proper diagnosis in order to be treated properly if indeed you have H. pylori and symptoms of gastritis for that matter. But in general, keeping healthy, washing your hands frequently will not just help you stay away COVID-19, but prevent other diseases as well and keep your body overall healthy. Before we go, Doc Mitch, do you have any advice for our viewers when it comes to not just gastritis, but your overall gut health?
We have to be really conscious on what we eat. No? There are certain food triggers that can trigger dyspepsia and not necessarily gastritis. Alright? So at the same time, we have to do exercise, and especially for dyspepsia pala and heartburn, no? Yung mga may reflux. What is important is water intake because it can help dilute the acid that is inside the stomach and can also help wash away the acid that has gone up into your esophagus. So siguro isa po yun na maipapayo sa mga nanonood po natin ngayon, water.
And Dr. Joe, do you have any advice for our viewers when it comes to gastritis and trying to prevent it?
Kumain lang ng tama, huwag masyadong mabilis kumain, magalan ng pagkain, choose the proper food. Kung may nararamdaman, magpa-check up. I think yun na yung aking best advice.
Thank you, gastroenterologist Dr. Marie Michelle Simbol-Cloa and family medicine specialist Dr. Jonathan Babsay for sharing with us your insights. Always a pleasure to have you both on the show. Here on Med Talk Health Talk, we hope to bring you the knowledge and care that you need. I'm Dr. Freddy Gomez, and we'll see you again next time. Stay safe, everyone.
RPN Radio Philippines Network, Radyo Ronda.